Bismillah ar-Rahman ar-Rahim. Assalamu alaikum. This is Dr. Waqar from Child Health Matters. So today I will talk about EpiPen in communication station of MRCPCH Clinical. So what question role player may ask? Before that, I would like to tell you any scenario with a device, for example, glucagon injection or inhalers, you should remember things like you have to explain about the parts of the device, indications about the device, and emergency use about the device, and how to apply, and precautions which could be related to the patients, related to the device. So there are two precautions. So these things you should remember before you are going to deliver the communication scenario in the exam. So what question role player may ask from you? So don't forget, before you go, introduction, repo, clear your role, ask for attendant and previous knowledge. At the end, never forget summarize and provide trusted websites and leaflets. So these are the things. There are marks. So save your marks while making yourself perfect in these things. This is the not thing which is medical. This is the communication thing. So what is EpiPen? First of all, you have a scenario and they are examiner, role player is asking you what is EpiPen, or you want to explain what is EpiPen. If there is a EpiPen available at that on the table, please take that EpiPen, and while you are explaining the EpiPen or any device is available there, you should take that device and explain it while it device in your hand, and at the end also you will give to the role player and tell them how to use it. So these are the things which examiner is watching. So what is EpiPen? The definition of EpiPen: it is the handheld device which is automatically inject a measured medicine, also called adrenaline auto injector. It is pre-filled the same medication which we are giving in our emergency department. So this is the definition. It is a handheld device, automatically inject a measured medicine, and it's called adrenal auto injector, and it is the pre-filled medication, which the same medication which we are giving in our emergency department. How can I use it? So at that time you should tell the role player about the parts of the EpiPen, and before using of the EpiPen, definitely you should explain about the parts of the EpiPen. What are the parts of the EpiPen? So in the next slide I will let you, and then they might ask you when should I apply. So indications, what are the indications? So this is the EpiPen, and you might have been seen before, or if not, you now you can see it. It has the top, which is the, let me to change the color. Yes, top, which is the blue cap, and at the end, which is the needle end, which is the orange in color. So top is the blue, and at the end it is the orange in the color, and it has the two windows. One is the which is on the other side. The one window is the transparent window, which is telling about the medication. If it is discolored, definitely need to be replaced. Another is a black window with there is a written of expiry date. You must have to check about the expiry date frequently. So before use also to check the expiry date. So they have the black window and the small transparent window. So there are two windows. I will show you in after at the next slide these two windows. So blue cap and orange end, which is the needle end, and two windows. One is the black, which is shows the expiry, and other is the transparent window, which is telling about the medication. If it is discolored, need to be replaced. So these are the parts of the EpiPen. So other questions they may ask you about when I should use. So these are the indication. As you know, this EpiPen can be used during the anaphylaxis shock, right? So anaphylaxis shock, definitely if we are doctors and we can recognize the anaphylaxis shock, but if for example only rash, so attendant cannot recognize. So they are asking if he develops rash because it is severe allergic reaction, life-threatening allergic reaction is anaphylaxis. So they might ask you, is there if there only rash, shall I use the EpiPen? So you can tell them that if it is allergic rash only, usually we don't use. If the child has breathing difficulty, if you feel that he has profuse sweating, if he has a fainting attack, so definitely these are the clear-cut indications. But if you have doubt and he has only rash, and if you have doubt, it's better to use it. Don't say that rash you will not use it. If you are dealing with the doctor, if you are communication with the medical student, yes, rash is not only the only rash is the not indication to use the adrenaline. But if the role player is the mother or the father, so if tell them, if you have doubt, please use the EpiPen. It's better to give if the child might is suffering from the anaphylaxis. They are not the trained one who can tell this is anaphylaxis or not. So where and how to give? So this is the question you might face, where they should give and how should they apply. So they should hold the EpiPen in their dominant hand, and they should remove the blue cap first, and the blue cap should be upwards, and the orange cap towards the thigh. So they can memorize by that: blue towards sky, orange towards thigh. So they should apply outwards of the thigh, and remove the blue cap, and just firmly keep the blue orange end towards outer side of the thigh, and just they will hear this click sound, and after that they should hold the medication 3 to 10 seconds, so that medicine should be delivered. So this thing you should have to tell them very clearly and ask them, did you understand or not? This is the thing which is very important. And they can apply the pen even with the clothes. If it is thick clothes, like for example the jeans which are very thick, and so after they can remove. Otherwise the normal clothes they can use above the clothes as well. Make sure you are telling them clearly, directly. They should apply, hold in the dominant hand, blue towards the sky, orange towards the thigh, and inject firmly, and they will hear the click sound, and then they will count up to the 10 seconds to so that medicine should be delivered. Okay, so now they are asking you, for example, the question: what if my child is at school, or in the bus, or with the friends? Yes, so at that time you we should tell them that okay, so at that time we should tell them that child has to carry EpiPen with him in his bag, and school teachers should aware of his condition. Even in the bus driver should aware of the condition, or bus nanny should aware of this condition and how to apply the EpiPen. And whenever you go outside, child should carry this you should carry with you this medication. So wherever child goes, the medication, this EpiPen, should be with the child, and you are providing 2 EpiPens to the child. So they may ask you, why 2 EpiPen? So 2 EpiPen is because if the 1 EpiPen they used, and after 5 minutes still child has the similar symptoms and child did not respond with the first EpiPen, they can use the second EpiPen. First they should if allergic reaction has they found the child is goes into the anaphylaxis, tell them to keep the child on the safe place, lie down on the child on the safe place, give the injection. After giving injection, call the ambulance. So wait for 5 minutes. If child shows he is not showing any improvement, and child does not show any improvement, then they can use another EpiPen. We can say it could be the rebound allergic reaction, rebound symptoms could be there, so they should give the second EpiPen. That's why we are providing them 2 EpiPens. So these things you should mention very clearly to the role player, and they should bring to the emergency department. At the end you should tell them, whenever you use the EpiPen, make sure when you come to the emergency just replace with the new one. and frequently they should check the expiry date and the transparent window. If transparent window is discolored, they should replace. If it is expired, they should also replace.